I'm Adrian Abrams. I'm the Chief Product Owner for the Quality Payment Program. You can find information on the program at our website, qpp.cms.gov. In this demo, we'll show how advancing care information reporting is completed for alternative payment model entities using the new user interface on qpp.cms.gov. If you're watching this on YouTube, you can go to the description section below for an outline of the topics covered and the minute on the video in which we discuss it. Let me just take a moment to set some context before we start this demo. Advancing care information can only be reported by an entire group or for an individual clinician. It can't be reported at the level of an alternative payment model entity. For the purpose of this demo, when I say group, I'm referring to all clinicians that bill using the same TIN, and when I say clinician, I mean a specific NPI billing underneath the TIN. Eligible clinicians participating in alternative payment models are required to report advancing care information. It is these individual clinicians or their groups that are required to take the action of submitting advancing care information data. So the actual process of reporting advancing care information for individual clinicians or groups is how alternative payment models complete ACI submission. When the submission period closes, which is currently scheduled for the end of March, the system will use the most recent data on the eligible clinicians participating in MIPS alternative payment models and the advancing care information data submitted by those clinicians to calculate an advancing care information score for MIPS. Just a quick note here, for clinicians in shared savings programs, ACI reporting must be done at the TIN level. We will not use ACI information reported by individual clinicians unless these clinicians are sole proprietors within their TIN, so basically a group that has only one NPI billing within it. And this note is specific to SSP, the Shared Savings Program. This demo will show you where you can see the score of an ACI submission for a group or an individual clinician as the submission is occurring. So let's get into the demo. When the submission period begins, a sign-in option will appear here on the upper right-hand side of qpp.cms.gov. When you choose the option to sign in to QPP, you'll be prompted to enter your EIDM user ID and password. If you've never set up an EIDM user ID or password, you can go to the CMS Enterprise portal to register as a new user. If you've previously set up a user in EIDM and have a valid role assigned for any of these legacy programs in support of a group practice, a registry, or an alternative payment model, we will have imported your user and your password. Those programs include the Physician Value Modifier, the Quality Resource Usage Reporting Program, QRUR, the Physician Quality Reporting System, PQRS, and the web interface used to report quality data. Also, check out the QPP EIDM User's Guide that will be available in the resource library that you can find under the menu at the top of qpp.cms.gov. For this demo, we've set up an account so that I am a security official for a group. The account is fake, so there is no real data used in this example. I'll have to attest to a statement of truth, certifying that I am, to the best of my knowledge, submitting this information that is true, accurate, and complete. Again, this is only a demo in my example, and we'll ask you to read this entire statement of truth yourselves. I've set up this account for multi-factor authentication via phone call previously. You'll hear the phone call now.
Hello. Thank you for using our phone verification system. Your code is 21700. Once again, your code is Goodbye.
I've successfully logged in with my user, who is a security official for a group practice, and arrived to my account dashboard. The account dashboard shows the roles that the EIDM user has been assigned and approved for. So in this example, this group practice security official has roles with multiple group practices. To submit advancing care information, first I need to select for which group practice I'm going to be submitting data. I'm going to submit data for the topmost TIN in this example. In a real environment, this will reflect the official group practice name that we have associated with the TIN if it is on record. Should make navigation a little easier. The next decision is, am I going to report the data and begin a submission for the group, so for all NPIs that bill underneath this TIN, or for a specific individual within my group, so for one NPI within this TIN. I'm going to report as a group, so I'm going to begin a submission for this entire group. I'm then presented with the option to start any component of a full submission: quality measures, advancing care information, or improvement activities. In this case, I'm going to start advancing care information. This is the advancing care information submission screen. You'll find full instructions on how to use this page here. First feature to notice here is the file upload. If you're choosing to report using a QRDA3 file, downloaded from your EHR potentially, be able to upload that file here. I'm selecting a file off my local machine's desktop. I'm loading it. You'll see a pending upload status here. To process the upload, I've clicked on the Upload All Files. It's processing this file, and it's demonstrating that it is completed successfully. That means that a submission has been created of the type EHR. A second button here is now visible because I uploaded a QRDA3 file that had a submission method of EHR within it. We'll review the contents of that submission a little later on in this demo. Let's use the user interface to complete advancing care information via attestation method. Let's collapse this left navigation here, give us a little more room to work. The page is organized so that the user is forced to work from top to bottom to complete the task of submitting advancing care information. You'll notice right now there are no options that the user can complete. The initial is to complete the performance period listed here. A few things to be aware of in the performance period. If a user tries to enter a performance period where the end date is sooner than the start date, we'll inform them that the construction of the performance period is invalid. You'll see that here. If a user has a performance period less than 90 days, then this message appears informing the user that they are capped at a total of 50 out of a possible 100 points in the advancing care information category. In this demo, I'm going to use longer than a 90-day reporting period. You'll see no message appeared, so I'm still working with a potential 100 points. The next section is to aid you in selecting the types of measures that you will report. There are two measure set options available in 2017. The 2017 Advancing Care Information Transition Measures and the Advancing Care Information Measures. We provide some information as to the type of EHR certification or the certification edition year that allows an EHR to report a specific type of information measure. This feature is intended to aid you in identifying what kind of measure set your EHR is certified to report. So here I'll use the search bar. I'm just going to enter in EHR. The first EHR that appears is Charm EHR. I'll select that from the autocomplete options. I'm shown that there are 3 different editions of Charm EHR. I'm going to choose the most recent edition. And now I'm being instructed that the 2014 edition of Charm EHR uses the 2017 Advancing Care Information Transition Measure Set. Now we can continue on to the next phase of the process. There are 3 possible selections: the 2017 Advancing Care Information Transition Measures, the Advancing Care Information Measures, and then a combination of both measures if one is choosing the option to record a report using a combination of the 2017 Advancing Care Information Measures and the Advancing Care Information Measures. The 2017 Advancing Care Information Transition Measures is the one that's currently highlighted. This is because I used the search feature above to identify that my EHR presently was using or made available the 2017 Advancing Care Information Transitions Measures set. If I don't want this guidance, I can eliminate the EHR that I searched for by clicking X in the search box. And you'll notice now that all 3 options of measures are present and available. I'm not being guided through the experience. For the purpose of this demo, we'll use the 2017 Advancing Care Information Transition Measures to walk through. The first category to complete are the attestation statements for the Advancing Care Information Performance category. You must complete this section before proceeding lower. You'll notice there are currently no other options to enter information lower down. The initial attestation is the prevention of information blocking. Expand out the content by clicking on the sideways and downwards arrow here. It's right here. Review the statement. If you concur, and click yes, and the yes will turn into a green check mark. Proceeding to the second statement, O&C Direct Review Attestation. Review the content. If you agree, click yes again. These first 2 attestations are mandatory. The third is not. So clicking these 2 attestations unlocks the next section, Required Measures for Base Score. I'm going to review the O&C ACB Surveillance Attestation. Concurring, clicking yes. Now available is an Advancing Care Information Score in this red ribbon. You'll currently see it set at 0 over 100. You'll remember that we chose a performance period in excess of 90 days, so our potential is still 100 points. You'll see this start to increase as we complete the first section, the required measures for base score. It's the minimum that is necessary to receive credit in the Advancing Care Information category. The first measure is the e-prescribing measure. We provide a high-level summary of that measure here in the text below. If you're looking for more in-depth information on this specific measure, there is a downward arrow to the right of the e-prescribing measure name. You can click that icon and download a PDF to your browser. This document will provide you an in-depth look at the definition of that measure. To the right you'll notice a numerator and denominator field where information can be entered. At the bottom of this particular measure, you'll notice a specific exclusion. The definition of the exclusion is available by clicking on the question mark icon. If eligible for the e-prescribing exclusion, clicking on this box will gray out the e-prescribing measure. This allows the user to proceed to the next measure without completing the e-prescribing measure. I'll uncheck that here. If I have not clicked the e-prescribing exclusion, I'm able to fill out a numerator and denominator. They must be valid values. So you'll notice the numerator is currently set at 1, the denominator at 0, which is an invalid value for this measure. I'm not able to save this measure. If I update the denominator to a valid value, I now receive a thumbs up. This should prompt me to move on to the next measure. I'll review the security risk analysis content here. I can download measure specifications if that would be helpful. I concur with the security risk analysis statement. Click yes. Continuing on to the provide patient access measure. Again, I can download measure specifications. I have a numerator and a denominator to enter. I entered a valid value of 1/10. The system saved my information. I've got a thumbs up again, indicating I can continue on to the next category. Here's the final measure in the required for base scoring section. The Health Information Exchange measure also has detailed specifications for download, as well as a checkbox for exclusion. Functionality works the same as described above, and a numerator and denominator for completion. You'll notice that the Advancing Care Information Score will now update dynamically because we are about to complete the measures required for a base score. I'll do that here. I have achieved a 2 out of 20 on this measure, and my overall Advancing Care Information Score has increased to 54 of a total 100 points. As you'll see in the rest of this demo, even though I have not achieved maximum points on this measure or the previous measure, which has now been scored because I've completed the section, I still have the ability to achieve the total 100 out of 100 potential Advancing Care information points. The next section is now available, which are the optional performance measures. I'll review the immunization registration reporting, or download specifications for more details. Confirming yes. And continuing to patient-specific education. Again, details available for download. And now on to securing messaging, numerator and denominator being entered. View, download, and transmit is the next measure. Medication reconciliation is the last in this section. Also a numerator and denominator measure. As we've proceeded through the section, you've seen that entering a numerator and denominator and then moving on to the next section reflects a score in the performance score section, as well as an increase in the corresponding Advancing Care Information category score here. The additional registry bonus section is next. A user can complete both of the bonus questions, but will receive only one 5% bonus. I'll demonstrate here. I now receive my 5% bonus. My score is 73. Checking the second bonus, I'm confirmed that I've done it effectively. I've got an NA for no additional score being provided, and my ACI category score has not increased. The final bonus is the cert used bonus. This requires selecting a corresponding improvement activity. You can see this in one of the videos that reviews attesting to improvement activities. Presently, in the way that we completed the Advancing Care Information section, we did not achieve 100 points. In a situation where we have inaccurately entered information, as an example, let's revise a few of our measures in the optional performance measures section, assuming that they were incorrectly entered the first time. We had intended to enter 10 out of 10 in each of these categories. You'll see the submission being updated and the overall score reflecting that update. And now in this section, when I update this and achieve 100 points, you'll notice a few features on the screen to highlight this achievement. One, this green 6X box down here demonstrating that we've achieved the maximum ACI score. Two, the category score success trophy. And three, a 100 over 100 points. So this demonstrates that we have achieved the maximum points available in ACI. This doesn't prevent or preclude us from continuing to report ACI data. It just demonstrates that we have achieved the maximum points to be contributed to a MIP score. This ACI score, in this example, for the group, is what contributes to the ACI scores calculated for the APM entities. Now that we've demonstrated the successful completion of the ACI category via attestation, let's review the results of the submission from file upload. Clicking on this menu option, you'll see the results loaded. You'll notice you don't have the ability to edit these because they were updated via file upload. The only way that these can be updated is by uploading a subsequent file that would replace this information. You'll notice that this submission that we did via file upload had a different performance period and potentially a whole different set of measures. For the purposes of this group and for APM reporting, if this group had submitted in both ways, the higher of the two scores is the one that the group will be credited with. Let's review one last feature here before we end the demo. How the QPP website supports submission for an individual clinician. Navigating back to my account dashboard, it's really only one unique action which enables a submission to be created at the individual clinician level instead of the group. If you'll remember, we'll navigate down to the practices for which this user has roles in the IDM. And instead of selecting the option to begin a submission as a group, I'll select the option to begin reporting as an individual. Here's an example of a clinician who bills under this TIN, and we have the ability to start a submission for this specific clinician. And although the menu looks different, it functions in the exact same way as we reviewed earlier. So selecting the Advancing Care Information option, we'll begin the submission, this time for the individual clinician, And all options, all other functionality and options remain the same. At the end of your submission, a user can log out and that completes a successful submission of advancing care information. So you'll notice that we never actually hit a submit button like you may have experienced in previous programs. The way submission works is you're able to come back and verify, review, and update the contents of your submission until the end of the submission period. At the end of the submission period, that submission will become locked and we'll use that data to calculate an official score. Thanks for watching this video. Check out our other resources on qpp.cms.gov.